Hi, my name is Bertha, and this is my week one Mri Lab presentation. The question number one, uh, it says list and talk about the items you would check yourself for and remove and lock up before entering zone 4. So basically, I will demagnetize. So I will self check from my top of my head all the way down my entire body to make sure I don't have anything ferrous on me. So I'm going to check for hairpins, bobby pins in my hair, earrings, necklace. If I have my watch on, I'm going to remove that. If my badge is metallic, I'm going to remove that. I'm going to also check my pockets to make sure my cell phone is not on me, as well as my wallet, credit cards, and loose change or car keys. I'm going to make sure I just don't have anything ferrous on me and have those items locked away and put away. But even so, always make good practice of self checking before entering zone 4. For number 2, it says explain the best way for identifying your patient. So basically, I would the best way to identify your patients is asking for the patient's first and last name, date of birth, and or IDing them. So if two people stand up with the first name in the lobby, then you would just approach the first person and then ask them to confirm their last name. If it's not a match, then proceed to the second patient that stood up and then go from there. If the patient has trouble speaking English or understanding what you're asking when you're saying what's your last name or what's your date of birth, then you can ask them to show you an ID, and then you can cross reference and match what you have on paper. An example of that would be if I went to the lobby and I called a patient's name, I would say Cindy, and once that patient stands up, I will have them go over to zone 2, and then I will say, "Hi, Cindy. My name is Bertha. I'll be the MRI technologist doing your exam today. Can you please confirm your last name?" Once they confirm their last name and they tell me their last name is Liu, then I can say, "Okay, can you please confirm your date of birth?" And then once they do that, then I can cross reference on what I have on my requisition. And then I would also tell them like the duration of this exam. So I say, well, here I see you're here for a MRI scan of your head. So this exam is going to take about 15 minutes. Okay, and then once I have completed their exam, then I'm going to thank them for allowing me to care for them today, and then I'll proceed. So, with when it comes to minimizing risks of infection, basically after you're done scanning a patient, you definitely want to go into the scanning room and flip the room by putting on some gloves, grabbing some sanitizing wipes, wiping down the scanning bed, head coil, the wiping down the coils and the headphones, flipping the dirty linen sheets to clean linen sheets, and just making sure that I'm also practicing hand washing. So it's good to wash your hands before and after starting IV, as well as wiping down your work area, like your computer, keyboard, the mouse, things like that. So that's a good way to prevent and lower the risk of infection, is basically practicing good hygiene by washing your hands.